Hello, and good morning. My name is Steve Lipstein. I'm the President and Chief Executive of BJC Healthcare, and we are delighted that all of you are here this morning at St. Louis Children's Hospital. Speaking on behalf of all of the staff and employees of BJC, and especially those professionals here at St. Louis Children's Hospital, we are delighted to welcome back Governor Jay Nixon, especially on a day such as today, when the governor is acting on behalf of Missouri's children. Earlier this morning I mentioned that the governor has a very, very big role to play in our state, but one of the other titles that he holds is that of dad to two sons. And when you're acting on behalf of children, you can't help but think about your responsibilities as a parent and as someone who safeguards the well-being and the welfare of children. Today, the governor is going to sign before you two important pieces of legislation, one dealing with congenital heart disease and the other dealing with safeguarding and protecting the well-being of children, especially in situations of abuse. We applaud all of the work that the governor has done on behalf of Missouri families, not just in the area of healthcare, but also in education and in terms of public safety. So please join with me on behalf of everybody who works here at BJC Healthcare in welcoming the governor of the state of Missouri, Jay Nixon.
Thank you and good morning. It is a pleasure to be here at this point of excellence of our state, quite frankly, of our country. Children's and the BJC network provides just incredible help and support to so many families and has made a lifelong difference in so many lives. I want to thank Lee Federer and Steve Lipstein and the entire team at BJC here and St. Louis Children's Hospital for hosting us today. For over 130 years, St. Louis Children's Hospital has tended to the physical, emotional, and social needs of children and families in this region. This outstanding institution is driven by a simple yet vital mission: provide the best care to our most vulnerable and most important population, children. I want to thank this bipartisan group of legislators being here with me today. I mean, it's very easy for folks to get cynical about public service, but when you're at moments like this, when you see urban and rural, east, west, north, south, Democrat, Republican coming together for measures like this, it gives you a very good indication of what can happen when people work together. And I thank each of these members for their individual and collective leadership. We're also joined by nurses, doctors, lawyers, and faith leaders, child advocates and law enforcement officers, dedicated professionals who work tirelessly day in and day out to heal the sick, protect the innocent, and prosecute those who would prey on them. And that is what brings us here today. Our future depends on the young, but until then, they depend on us to keep them healthy and safe. It's a responsibility we share and an investment that will yield enormous returns. We want to make sure every child has every opportunity to grow up healthy and strong and reach their God-given potential. And that means starting day one. Each year, roughly 7,200 babies are born with critical congenital heart disease, or CCHD. CCHD refers to any number of life-threatening abnormalities that prevent a baby's developing heart from pumping blood. Many of these heart defects are treatable with quick intervention, but the symptoms aren't always obvious. And if these problems aren't detected, they can't be fixed. Senate Bill 32, which I will sign in just a moment, will make sure that babies born in Missouri are screened for CCHD using a simple, affordable device called a pulse oximeter, which measures oxygen in the blood. It is estimated that requiring this screening could save between 50 to 100 lives in Missouri alone each year. Senate Bill 32 is named for 4-year-old Chloe Mans of Lee's Summit, who was born with congenital heart problem. Fortunately, her mother Kelly, here with us today, and Kelly, thank you for your leadership here and your indefatigable efforts of walking the marble halls of Jefferson City to make sure this got here, insisted that her daughter be tested with a pulse oximeter. That test led to surgery that repaired her heart and saved her life and educated a mom about how necessary this test was. I want to thank Senator Dan Brown for sponsoring this bill and Representative Rick Bratton for handling the bill in the House, as well as the March of Dimes, the American Heart Association, and the American Academy of Pediatrics for their hard work on this legislation. Without all of that combined effort, we wouldn't be here to sign that bill into law today. So Senate Bill 32 will be the first bill I sign. But as we have seen, the risks to our children don't end when they leave the hospital. Here in Missouri and across the nation, we have seen horrific cases of child abuse and neglect. We've seen suspicions confirmed but not reported, concerns swept aside, inconvenient truths ignored, and cries unheard. These are unspeakable crimes, but we cannot and will not be silent. We must speak for those who cannot speak for themselves and break the insidious wall of silence that too often surrounds these cases. And that's yet another reason we're here. The organization that investigates, deals with these kids, works directly with law enforcement, works directly with parents, this organization here, and also trains physicians, clinicians, and others from around the state is right here at Children's. This is the place where when law enforcement goes and parents go and know that it will be handled professionally, well, and very sensitively. So House Bill 505, which I will sign in just a moment, takes important steps forward in this area. Current law requires certain individuals, like doctors, nurses, teachers, and coaches, and law enforcement officers, to report suspected child abuse or neglect. But instead of making a report to the Children's Division directly, mandatory reporters can opt to tell a superior or other designated agent within their organization. This may be in the best interest of that organization, but it is not in the best interest of that child. We all saw what happened in the tragedy of Penn State, where the organization received the information and others did not. Where suspected abuse was reported up the chain of command, but not to the authorities. That is why, based on the recommendations of a bipartisan task force, House Bill 505 requires that suspected child abuse be reported immediately, not to a superior, not to an internal committee, but directly to the Children's Division. So there will be no delay. This will help to eliminate delays and make it clear that an individual's responsibility to report abuse promptly and directly rather than just turning it over to someone else. This is not a responsibility that any of us pass to anyone else. The reporters have that responsibility, and I thank that bipartisan group for coming up with this common sense, aggressive, appropriate solution. I also this morning, before I left Jeff City, signed Senate Bill 256, which extends from 5 to 45 days, the period during which a parent can voluntarily relinquish a child to proper authorities. That is an important measure also, and I thank folks for helping get that through the legislature this year, which will allow difficult choices to be made in a more timely fashion so that we can all value children, value life, and value the things that we hold dear. I also want to take this opportunity to express our deep gratitude for those on the front lines of preventing child abuse and neglect, the Children's Division staff, local law enforcement, officers of the court, and the organizations that work with them every day as they carry out their vital work protecting our most vulnerable children. These law enforcement officers and leaders that are with me today do the tough work, each and every day dealing with these issues, but quite frankly, without the strong professional efforts of organizations like BJC and Children's, we wouldn't have the backbone we need, because they are not, it is necessary for them to rely on these medical, social professionals. They do good work, important work, and for that, we're very, very grateful. So now what I'm going to do is I'm going to sign Senate Bill 230 and House Bill 505 into law. Then I would be glad to take any questions from press. Let me make a little law first here. I don't have enough, but you need one.